an exam room, right? And the entity diagnosing your illness isn't actually human.
Oh, boy.
Yeah. Like an algorithm, which, I mean, sounds like a pitch for a bad sci-fi movie. But in Delaware, the threat of an AI doctor was actually real enough that on April 23, 2026, they had to pass a law.
Right, House Bill 191.
Exactly. They passed House Bill 191 just to make it explicitly illegal for an artificial intelligence to be licensed as a physician, a nurse, or to even use a title like doctor.
It is honestly a pretty staggering piece of legislation when you stop to really think about it. I mean, it codifies a very simple but suddenly very necessary baseline principle,
Yeah.
which is that patients have a fundamental right to know who, or I guess in this specific case, what is providing their health care.
Right, which brings us to the core mission of our deep dive today. So we are looking at this really fascinating policy debate that's emerging from the Center for Health Policy at the Caesar Rodney Institute.
Yeah.
And the central premise is just brilliant in its simplicity, honestly.
It really is.
It's basically asking, if the state believes you have the absolute right to know when your doctor is a machine, well, shouldn't you have the exact same right to know the real human credentials of the person treating you?
Yeah, that's the big question. But before we really get into the weeds here, I do need to offer a quick point of clarification for you listening.
Oh, yeah, good call.
The sources we are unpacking today, they contain some very professionally and honestly politically charged viewpoints regarding medical credentials, scope of practice, and healthcare policy. So we want to be incredibly clear right up front that we are not taking sides here.
Definitely not.
We are endorsing these specific viewpoints. Our goal today is simply to unpack the arguments around patient rights, the legislative history, and consumer transparency, exactly as they're presented in this source text.
Right. Okay, let's unpack this, because the reality that we even need state laws to stop AI from practicing medicine is just bizarre enough on its own.
Yeah, it's wild.
But it perfectly sets up this very real, very current problem of human credential transparency. Like, to understand why this is suddenly such a massive issue in the waiting room, we have to look at how the basic rules of who can actually practice medicine have drastically changed.
Right, behind the scenes over just the last few years. Because the traditional model of healthcare, where you walk into a clinic and naturally assume you are seeing a physician for a medical diagnosis, that has been fundamentally altered by recent legislation.
Totally.
We are looking at a timeline of rapid state-level changes that have vastly expanded the authority of non-physician healthcare professionals.
Yeah, so let's look at that timeline. Because back in 2021, Delaware passed House Bill 141. And this law effectively eliminated the collaborative practice requirement for advanced practice registered nurses.
Which includes nurse practitioners, right?
Exactly. So before 2021, a nurse practitioner in Delaware had to have a collaborative agreement with a physician. It was basically like a safety net of oversight, meaning a physician was ultimately involved in the practice.
Yeah, they were available for complex cases or reviewing charts, that sort of thing.
Right. But House Bill 141 completely severed that tie. So today, they operate as independent islands.
They do.
They can evaluate patients, diagnose illnesses, order tests, and prescribe medications completely independently, like with zero physician supervision required.
And that trend of legislative expansion, it didn't just stop with nurse practitioners. Pharmacists have also seen a really major expansion in their scope of practice.
Oh, yeah.
So in 2022, House Bill 399 allowed pharmacists to step away from just dispensing medication. It gave them the authority to actually test, screen, and treat certain health conditions under statewide protocols.
Wow.
Yeah, and then just this year, in 2026, Delaware went even further with Senate Bill 320.
Right, that's the bill that lets pharmacists independently evaluate patients, right? And identify health conditions, order and prescribe lab tests.
Even prescribe certain drugs and devices, yes.
I mean, we are no longer talking about the person behind the counter just counting pills into a bottle. We are talking about someone pulling you into a side room, evaluating your symptoms, and writing a prescription. It's a total decentralization of medical authority.
And what's fascinating here is that as the state expands, who's legally allowed to practice medicine, and by that I mean who can diagnose and treat, knowing exactly who is providing that care becomes more important, not less.
Yeah, that makes sense.
Because as the pool of providers diversifies, the potential for patient confusion just skyrockets.
Yeah.
I mean, if a physician, a nurse practitioner, and a pharmacist are all legally permitted to perform similar diagnostic tasks, how does the patient know the difference?
Right. I think the best way I can wrap my head around this is to think about it like aviation.
Okay. Yeah.
Like if I'm on a commercial flight and I'm sitting in seat 12B, I just naturally assume the person sitting in the cockpit flying the plane is a fully licensed commercial pilot.
Sure.
Now, if the airline industry quietly changed the rules to let flight engineers fly solo, and look, maybe they are perfectly capable and well-trained for that specific route,
Right, right.
but as a passenger, I'd still want to know. It's not necessarily about saying, they are bad at their job. It's just about transparency. It's about knowing exactly who is at the wheel when my life is in their hands.
I think that pilot analogy captures the core of the debate perfectly. But, if they're doing the exact same thing in that exam room, like checking your throat, looking at your charts, writing a prescription, does it actually matter if the badge says NP instead of MD?
Well, yeah, that brings us to the invisible dividing line in this whole discussion, the clinical training.
Exactly.
And this is where the numbers get really stark. According to data cited from the American Medical Association, nurse practitioners complete approximately 500 to 750 hours of clinical training as part of their graduate-level education.
And let's put that into perspective for a second. 500 hours is roughly equivalent to, 12 and a half weeks of full-time, 40-hour-a-week work?
Wait, really? Just 12 weeks?
Yeah, roughly.
Wow. Which, that sounds substantial until you put it next to a physician's requirement.
Right.
Because we're looking at 12,000 to 16,000 hours of clinical training through medical school and residency for a physician.
Yeah.
That's not just a gap. That's a completely different universe of training. We are talking about years of managing complex patient cases, working under intense supervision, rotating through specialties, often pulling 80-hour weeks.
Yeah, the source material really emphasizes that. While precise training obviously varies by program and specialty, these are entirely different professions with substantially different levels and pathways of clinical experience.
Right. Yet to the average patient who's just sitting in the waiting room, probably anxious about their health, it's just this alphabet soup of credentials on a name badge.
Oh, completely. You have MD, DO, APRN, NP, DNP, PA.
Yeah, and the average consumer is not equipped to parse the nuances between an advanced practice-registered nurse and a doctor of osteopathic medicine. Not while they are sitting there worried about a lingering cough or a strange rash.
No, of course not.
And here's where it gets really interesting, I think. Because the source specifically focuses on one credential that deeply muddies the waters here. And that's the DNP, or Doctor of Nursing Practice.
Yes. The DNP.
Now, if someone went to graduate school, did all the work, wrote the papers, and earned a doctorate, like a Doctor of Nursing Practice, shouldn't they be allowed to be called doctor? No one is arguing they didn't earn their academic doctorate, just like a college history professor earns theirs.
Well, it's a context problem, really.
Yeah.
Words have entirely different functional meanings depending on the environment you use them in.
Right.
So in a university classroom, if someone says doctor, you understand it means a professor with a PhD. At a dental office, you understand it means a dentist.
Yeah, obviously.
But in a clinical setting, with a stethoscope around your neck, the word doctor implies physician to the vast majority of patients. It has just been the cultural baseline for a century.
And the data proves this confusion isn't just hypothetical policy wonks complaining. It is incredibly prevalent. The American Medical Association survey data cited here shows that 39% of respondents, almost 4 out of 10 people, identified a doctor of nursing practice as a physician.
And that confusion extends across the board.
Yeah.
19% thought a nurse practitioner was a physician, and 17% thought a physician assistant, a PA, was a physician.
Wow.
The data clearly shows that patients are genuinely confused about the actual qualifications of the person treating them.
And the thing is, the confusion doesn't even require the provider to actively deceive anyone. They don't have to walk in, twirl their mustache, and declare, I am a physician.
Right, no one's doing that.
The confusion is just baked into the environment itself. Patients form their impressions based on the practice's website or the scheduling process, the identification badges, and, those classic visual cues we all recognize.
The white coat.
Exactly. If someone walks in wearing a white coat with a stethoscope and says, hi, I'm Susan, they sound incredibly warm and friendly, but you, the patient, are left completely in the dark.
Yeah.
Is Susan a physician? A nurse practitioner? A
Yeah.
physician assistant? You have absolutely no idea based on that interaction alone.
And this raises a really urgent question about the legal framework governing healthcare transparency. If patients are this demonstrably confused, and if the clinical training gap is this significant, Why isn't there already a law to protect patients and ensure clarity?
Wait, I'm actually a bit confused here. Because according to the text, Delaware does have laws on the books?
Yes, they do.
Like, Section 1703 of the Medical Practice Act specifically states that when someone uses the title doctor in matters related to medicine, they must specify the type of doctorate they hold.
Correct.
And Section 1766 makes violations a literal Class B misdemeanor enforced by the Attorney General. So if it's a crime to misuse the title, how is anyone getting away with it? Are clinics just flat out ignoring the law?
Well, no, they aren't ignoring the law. They're operating within a pretty massive legislative loophole.
Oh, a loophole.
Yeah. Existing law primarily governs what healthcare professionals are allowed to call themselves in formal settings or in advertising. It does not require them to affirmatively tell the patient who is treating them once they get in the exam room.
Oh, I see. Okay, so a provider can perfectly comply with the letter of the law, like they never explicitly claim to be an MD, they don't have a badge that falsely says physician on it,
Right.
and yet because they didn't proactively explain their actual credential, the patient can still walk out to their car mistakenly believing they just saw a doctor.
Exactly. Compliance with the title law does not guarantee patient comprehension. And this is where we can actually look outside of Delaware to see how other states are handling this issue more effectively by closing that exact loophole.
Oh, interesting. Like who?
Well, Georgia is a really great example of this. Georgia law actually requires healthcare practitioners to clearly communicate their specific license to patients. So nurse practitioners and physician assistants have to verbally identify their profession during every single patient interaction. And if a nurse practitioner in Georgia uses the title doctor, they have to make it explicitly clear to the patient that they are not a physician.
Oh, wow. Yeah, that's super direct.
Right. And Illinois has a similar statute on the books requiring advanced practice nurses to verbally identify themselves to patients. California has gone even further by heavily restricting how the title doctor can even be used in medical settings to begin with.
So the precedent for stricter, like, active transparency is already established in multiple states.
Yes, and it usually takes just a few seconds. Just a simple, "Hi, I'm Susan, your nurse practitioner."
Right. So what does this all actually mean for you, the listener? I mean, are we expecting everyday people to become credential detectives in the waiting room?
I hope not, right?
Are you supposed to sit there interrogating Susan in the white coat about her clinical training hours before you let her look at your throat?
No, and the burden of transparency should never rest on the shoulders of the patient. Think about the power dynamic in an exam room. The patient is often anxious, they're in pain, they're vulnerable, and they're sitting there wearing a paper gown.
Yeah, it's not a great position to be in.
Exactly. They shouldn't have to decipher an alphabet soup of healthcare credentials or feel awkward asking a direct, potentially confrontational question about qualifications. They should simply be told, clearly and upfront, every single time.
Which brings us to the ultimate call to action in this policy push. So there's currently a petition circulating to bring back and strengthen a specific piece of legislation in Delaware.
The Healthcare Professional Transparency Act.
Yes, originally introduced as House Bill 447.
Right, and just to give some quick background on HB 447, it was originally introduced in 2024,
Yeah.
and it would have required healthcare practitioners using the title doctor to specifically identify their educational degree and their professional license.
Okay, makes sense.
It also mandated visible identification showing the practitioner's name and license type, and required healthcare advertisements to be explicitly accurate about those licenses.
But it was pulled before a committee vote. It never actually became law. So now the push is to urge lawmakers to revive this bill in the 2027 legislative session, but with even stronger provisions.
Right. The proposed strengthened version of the bill would require patients to be clearly told, affirmatively, before any non-emergency care is even provided, whether the person treating them is a physician, a nurse practitioner, a physician assistant, or another licensed professional.
Yeah, and the petition attached to this initiative poses 3 specific questions to the public. And I want you to think about your own experiences for a second as we go through these.
They're good questions.
Yeah. So first, before today, did you actually know that a nurse practitioner could diagnose and treat you independently in Delaware without a physician ever looking at your chart or supervising the care?
It's a stark reminder of the gap in public awareness, isn't it? Just regarding how rapidly healthcare legislation has shifted underneath our feet.
It really is. Okay, second question to think about. Have you ever walked out of a clinic or a hospital thinking you received care from a physician, only to learn later that you were treated by a nurse practitioner, a physician assistant, or another type of professional.
This one really grounds the entire policy debate in lived personal experience.
Mm.
It kind of forces us to reflect on our own assumptions in the exam room and how easily those assumptions are manipulated by the environment.
Definitely. And the final question. Should healthcare professionals be required to clearly identify their professional license to patients before diagnosing or treating them?
And ultimately, the source text asserts that this entire debate isn't about prohibiting people from using hard-earned academic titles, nor is it about dictating to patients which type of healthcare professional they should choose to see.
Right. I mean, you might prefer seeing a nurse practitioner for your primary care, and that is entirely your prerogative.
Absolutely. It really just boils down to a single powerful principle: consumer transparency.
Yeah.
It is about giving patients the accurate, unclouded information they need to make informed choices about their own healthcare.
Exactly. I mean, if lawmakers are going to step in and explicitly protect you from being secretly treated by an artificial intelligence under HB 191, the argument is that they basically owe you the exact same protection when it comes to the humans in the building.
It is such a fascinating collision of changing state laws, expanding medical roles, and the very traditional, deeply ingrained expectations patients carry with them when they seek medical care.
For sure.
The system has evolved so much, but our cultural understanding of the system just hasn't caught up.
So as healthcare continues to decentralize, whether you're being diagnosed through a screen via telehealth, treated by a specialist in a retail pharmacy clinic, or even one day triaged by the very AI that regulators are currently trying to manage, how will our fundamental understanding of the doctor-patient relationship evolve when the word doctor itself has completely changed its functional meaning?
It's a lot to think about.
It really is. So next time you sit on that crinkly exam room paper waiting for the door to open, take a close look at the name badge of the person walking in. It might just change how you understand your own care.